Good evening. Thank you for watching our update in English. I'm Leah Hogg, and we're starting our program today by joining the Honourable Dr. Maria Deguara from her home in Nashar. She's going to update us with the feedback we got. We were inundated after her participation in the last two programs. Good evening, Dr. Deguara. Thank you for joining us today.
Good evening to you and to all those watching us tonight. And I want to open this evening by saying that last week has been a very positive week because the number of active cases has decreased quite significantly during this last week. In fact, today, as probably you already know, from 1,762 tests, only 52 are positive, and we only have had 2 deaths declared, which means if the vaccine is showing its outcomes, but also that people are observing the directives given by the health department. It's very, very important now that Easter is with us, that we abide by these rules, because if we don't, we may get again a rise in the positives. Vaccine definitely is working, and we should help in all our way to try and get the rollout of vaccine to increase as quickly as possible.
So
Last week,
very encouraging, really, very encouraging.
It is encouraging, and I want to encourage even more those who are watching us tonight to try and take the vaccine as quickly as possible. And having had the feedback from last week, where there was a lot of complaints that they were not getting through on the 145, I have to inform them that I did get through on the 145. We've sent all those who had or made the official complaint to us, and we have an answer to every one of them that has put in the complaint. We also know now that people between 55 and 59, between 65 and 69, should now start registering, and these will be given out on the media how they should do this registration, or by contacting the 145. I was also informed when I gave the names that were given to me that about over 1,500 more invites have been issued for those over 70. In fact, if there are still people who are over 75 and have not received an invite, please call the 145, give them your details, and they will obviously see to it, because we already have 95% of the over 80s vaccinated, and we want to push also the percentage of the over 75s. It has also been known through this week that the Johnson & Johnson vaccine should be with us soon, and that it is indicated from 18 years of age upwards. There is also more experimental work being carried out with the Pfizer, because probably this will be expected to be given also on to the younger age group. But before these experiments are finalized, we cannot say exactly from which age this should be given. But probably within the near future, we should know the outcome of also these experiments which Pfizer is carrying out.
May I just point out the news that we saw this week about Pfizer's study under 12 to 15-year-olds. What are your comments about that?
This is, in fact, what I was referring to in the Pfizer, that there is experiments being carried out to see whether they can go to the younger age group. But it has not been yet specific that which age group, from which age group should be given. So I think we have to wait before we have the official results, before we go public to say which age group or from which age group upwards will be indicated.
Mm-hmm. I mean, the feedback we got last time, I have to repeat, the complaints, if we have to say complaints, were about the response from 145. Other than that, I think everything seems to be going on track. Do you agree with me?
Yes, I have to admit, sometimes if you go to 145 first time and you don't get through, doesn't mean they are not answering, because I have to admit, I went first time, but I did make my phone call quite early in the day. I got through and I could send all the emails where they told me. And I got also a response from who was organizing the vaccination within a few hours. And by the following day, we had everything settled. So everybody should give his share. I mean, we don't get through by just dialing once. Try and persist, because I'm sure the outcome will be good. And we have to give chance also to those who are answering the phones to be more specific what the complaint is. And everybody should give her help to continue sending on those who have not received the invites yet. But I think on the whole, yes, we did have a better service from last week because more people had been put on the call on the phone of 145. So there are much more people answering our calls than it was last week.
The viewers who wrote in, most of them want to thank you, because I believe you actually gave feedback to each and every one of them. And I think it's put a lot of people's minds at rest, because you did follow up with the Ministry of Health personally, didn't you?
Yes, we did, and everything went in place. In fact, I have phoned some of them. Not all of them had to give me an answer, but those who phoned, they all confirmed what I had told them. So things are moving smoothly. One thing that I have to note also is the importance of keeping and abiding by the directives. The World Health Organization director, round about early afternoon, was in fact insisting about a faster rollout of the vaccine and keeping to directives. He said, because if we don't move them together, the outcome will not be as successful as we want it to be. So I again here implore everybody who is hearing us to keep to the directives which the health department is always informing us from day to day, and also to try and get the vaccine as quickly as possible.
And a few words, since we're approaching Easter weekend. This is a very different Easter for most of us.
Yes, this Easter has to be, we have to celebrate Easter in the family, not getting into the family too many extra bubbles, as we call them. We still maintain that even if if we're in the family, the less we are, the better. Because when you start mixing, you never know with this English variant that is highly infective, how it can get in. Even if we're even if we're alone, don't go more than 2. Because the more we control this pandemic, the quicker we control this pandemic, the better it's for our health, the better for our economy, and to get our country back on its feet.
Thank you very much.
It is a time when everybody has to work together to get success together.
Thank you very much for tonight again. Thank you, Dr. Deguara.
Thank you very much.
Thank you. Dr. Maria Deguara will be with us on a program on Monday evening with regards to services for the elderly. You will be seeing the WhatsApp number during this program. Any queries, please send them, and I'm sure she'll attend to them.